Hi, my name is Anu Subramanian. I am a clinical associate professor at the University of Iowa and the director of clinical education there. And before that, I was at Purdue University as a clinical educator as well. Today, I want to talk to you a little bit about how you teach Clinician Client Alliance in SLP graduate student education. For the past 10 years, in my job as a clinical educator, I've been thinking, reading, learning about different aspects of clinical education. One of the ideas about Clinician Client Alliance has always interested me, even when I was practicing as a clinician, being from a different culture, about how to build the alliance and how to connect with families that I was serving. So the question is, can you teach Clinician Client Alliance to graduate students, or is this something that's just a soft skill that people have or don't have? And based on evidence, we can teach students to build alliances with their clients, or we can build alliances ourselves with our clients. And so today I'm going to talk to you a little bit about that. My goal is to make 2 or 3 modules related to this. And in today's module, I'll be focusing on first on identifying why clinician-client alliance is important, secondly, giving you a definition of clinician-client alliance, and then 2 ideas of things you can do to help build clinician-client alliance in your graduate student. So why is Clinician-Client Alliance important? In psychotherapy, for the last many decades, they've been talking about what helps a person make progress. Why is it that some people make progress in therapy and others don't? Or why is it that 2 different approaches both yield progress in therapy? This is something we see in our field. There's 2 different kinds of stuttering therapy for young kids. Both help clients make progress. There's different types of child language therapy strategies. Kids make progress using either of them. So what helps a client make progress? What are the common factors in treatment success or treatment responsiveness? So this was developed following meta-analyses and systematic reviews in psychotherapy, and I think it applies to us as well. So the first thing is extra-therapeutic change, as you can see on the pie chart. And that accounts for about 40% of treatment success. This includes child and client or client and family strengths that we cannot control, the support system that they have, the education level, things like that. The second is the expectancy or placebo. So that works in our favor. There's an expectation for change, there's hope for change, so that helps. The third is technique, which is about 15% of variance. So I want to make it clear here that I'm not saying the technique is not important. The technique we use in therapy needs to be evidence-based and needs to be the right technique for the client. In clinical education, we spend a lot of time teaching students how to build their technique, which is important, but it only accounts for 15% of the variance, as you can see on the pie chart. So we have to also look at other things that we can do to improve treatment outcomes. The last one that I'm going to talk a lot more about is Clinician-Client Alliance, and that accounts for 30% of the variance. So this is why Clinician-Client Alliance is an important part of teaching students how to be good clinicians. So what is Clinician-Client Alliance? In a survey that I did recently as part of an honors thesis, most people responded by saying Clinician-Client Alliance is the relationship between the client and the clinician. And that is right. Borden defined Clinician-Client Alliance in 1979, and a big part of it is that relationship between a clinician and a client. This is something that seems harder to teach. How do you teach a student to develop this relationship or a bond? Does it something that someone has and just has an instinctive ability to build relationships? The other 2 parts of the definition, which are agreement on the goals of therapy and agreement on the tasks used to reach those goals, are more teachable. So we'll focus on these 2 aspects in today's module, and in the next module, I'll talk a little bit more about the relationship or bond. So agreement on goals of therapy and agreement on tasks to reach those goals are some things we can teach students. So today I'm going to give you 2 ideas of how you can do that. The first is called motivational interviewing. There has been one study in our field using voice therapy for motivational interviewing. When I was working as a clinician many years ago, there were, in early intervention, we were asked to ask parents the goals of therapy to write in the IFSP. The goals had to be written in the words of the parents and not in our words. So that is sort of like motivational interviewing. The other place that I've seen motivational interviewing used extensively is at the University of Iowa. Trisha Zabrowski has been using motivational interviewing in UI Speaks, our stuttering camp for kids who stutter. And it is, she uses it a lot with teens who stutter, or used it a lot with teens who stutter. This year, we used it with older elementary school kids who stutter as well, and it was great in helping them identify goals of therapy, helping them identify their motivation for making change and how they'll make that change. The third way that I've used motivational interviewing is with young kids with articulation disorder or speech sound disorder in younger elementary levels, to try to just help them understand why they're in therapy. They're not here to play anymore. They're working on their speech and how they can make changes in their speech. So motivational interviewing comes from the stages of change model, and the idea that as clinicians, we can motivate clients to make change based on a few questions we ask them. So these may be open-ended questions like, what would be the pros and cons of making these changes? What would be different in your life if you didn't X, like stutter maybe? What are some ways that you've made change in your life before? How am I going to support you in this process of making change? Things like that. So motivational interviewing is something that we've had grad students use often, and is very effective. So this is one strategy that you can use to build Clinician Client Alliance. The second one is using session feedback questionnaires. These were developed by the Institute for Clinical Excellence and Scott Miller and his associates, and are available online. These are used, they have session feedback questionnaires, outcome feedback questionnaires for adults and kids, and a lot of different ways. On this, you can see there's 4 areas that include the goals, the definition that Borden suggested: the relationship, the goals and topic, the approach or the tasks of therapy, and the overall relationship. So having a client complete this at the end of a session and hand it to the supervisor or hand it to the front desk person, because you don't want them to complete it and hand it back to you, helps understand where the alliance is and where there's breakdowns in alliance. When I've used it in a study that I published, we also asked 3 questions: what went right today, what would help you get more out of this, and what needs to be changed. With that, it's a great way to have a conversation with the student about where there's a breakdown in an alliance, or if there's no breakdown, then that's great. But if there's a breakdown, it's a great way to have a conversation and check in on the alliance at regular intervals with the student and the supervisor. So in today's module, what I tried to do was give you 2 ideas of things you can use to build the Clinician Client Alliance, focusing on goals of therapy and tasks of therapy. We also talked about why this is important and talked about the definition of Clinician Client Alliance. I would love to hear from you, my email, my phone number, my LinkedIn, about any thoughts you have, how you've developed Clinician Client Alliance, and what you think the importance of Clinician Client Alliance is. Next time, I hope to talk to you a little bit more about the relationship or the bond and how we can teach students to build that in evidence-based ways. Thank you.